Losing your memory and getting confused is a natural part of aging. Dementia is a disease. Well, dementia is not truly a disease, it's a condition.
What you just said, there was the person with dementia didn't have a task.
Dementia is common in the aging population. Matter of fact, 50% of people 85 and over, 50% will be diagnosed with some form of dementia.
Like you're saying, communication truly is key. And I've heard you say that so many times. We have the key. And you do, when you can learn how to communicate effectively and understand the person that you're helping and supporting with dementia, that just makes the difference of the world. Welcome. Today we have a very special guest. Her name is Dr. Lord. Dr. Lord is just amazing. She's been in the industry for a long time. She's a founder of ICA, which is International Caregivers Association, and Transactional Dementia Intelligence, which is TDI. It's a model that was developed to give caregivers insight and confidence on how to communicate clearly, reduce stress, and prevent burnout. And we are talking in the realms of dementia, right? And so I'm really excited because this is a hot topic, something that we really need to discuss. There's a lot of questions out there. People just don't know how to identify dementia, how to treat it, how to respond to it. There's not really there's not a cure, and we'll go through that, but there is ways to address it. And so Dr. Lord is going to share a lot of her insights, practices, and a lot of what she's brought to our community. So thank you for being here, Dr. Lord.
No, thank you very much for having me. I appreciate it. I'm grateful for this opportunity with you. Thank you.
Absolutely. Well, you've been in the industry for a while, but I really want to go back to how this all started. I know your story, and I think it's incredible. I feel like most founders of businesses or organizations like yourself, they started from a personal story. And so I would love if you would share a little bit about you and how did you start in this industry? Where did this all stem from?
It started with me being a really reluctant caregiver. Much like most people, I fell into it because my husband got sick. However, I had some background that helped me and gave me the advantage over a lot of other people. And one of them was as I was paralegal for legal services for the elderly in 1988. And so I had visited a lot of homes, a lot of assisted living, a lot of skilled nursing. So I knew a little bit about that, but I didn't know much about dementia. And he had vascular dementia. So in the 21 years that I took care of him from 1999 to 2020, that's 21 years. I saw everything. Right. I repeated everything that I had seen before, but now I was a participant. So I was very observant. I had to study. I had to research. I had to practice. And I helped a lot of people. So I realized, though, in that process that what I was looking at was a systemic problem, not just a model that I see now, models or even ways of dealing with dementia is only a model. It's not a systems approach. So my approach is truly unique in the sense that it is a systematic approach to correcting all these problems. And so I call it the Transactional Dementia Intelligence business model. And because we look at everything and we know there's a lot of money wasted in turnover and burnout. And so I bring that to the attention of people because one of the advantages of the TDI model, business model, is for CNAs who do 90 to 95% of the work, physical work. They work a 6-hour shift, but they're paid for 8 hours. And that's very easy to cover because they lose much more than that already in turnover and burnout. So that was well justified. And so I built this model because it reduces stress. It feels, people feel heard when they're spoken to. They feel understood and they feel appreciated. So I created a better quality of life really for everyone, not only the person with dementia, but the workers. Right. And everyone benefits. That was my goal, for everyone to benefit.
I really love this. For one, I'm a systems and processes person. I truly believe in them because it does prevent burnout, regardless of what field you're in. and it optimizes results. So I definitely can see where you're going with this. I also love this is twofold. So you're protecting the caretaker, and there is going, there's a little bit of a crisis out there. We're having more boomers age out, right? And then we've got less caregivers available, and that's going to continue to be a problem, right? So we want to address that right now and prevent burnout, prevent people from turning away from this industry, and really optimizing that level of care so that the resident, the patient, the senior, whoever it is that's being cared for, they're seeing better results. They're having an increased quality of life. So I love this model. I love this idea. You got into this, you had your husband, he survived this for 21 years. Now that's a long time, right? That's a very long time, Dr. Lord. How long is the average person live with dementia?
I often get that question, how long can a person live with dementia? And there's only one thing that I found in my research. It all depends on their cognitive reserve. Now,
Mm.
my husband was a university professor, so we had a good reserve. I went through the same thing as other caregivers. I almost burnt out because the average for home care is between 5 and 6 years. After that, you burn out, you get sick, or you die. So that's your options. You got three options. I got out of it and I placed him in assisted living. And I had to go see him every day because I kept a good eye on him. And he was my teacher and I was his student. So I paid attention to what he was needing and I met his needs. And in that process, he lived 21 years.
That's amazing. Now, you created ICA from this experience. Tell me a little bit. Obviously, this was an inspiration to that. What is your mission with ICA? What is it that you aim to do and make it? And how are you making a difference in the lives of professionals serving seniors?
Well, the mission of the ICA is very clear and is well known. The mission of the ICA is to elevate standards of dementia care so
Mhm.
that all individuals who choose dementia care as their profession or who suddenly find themselves having to provide dementia care to a loved one experience pride in their work and joy in what they do and are rewarded for their commitment to provide a positive experience to each and every care receiver.
Yeah, that's wonderful. And I'm going to back up a little bit because I think I'm probably jumping ahead. I'm just so excited about this topic. ICA, so International Caregivers Association, you certify and train caregivers, and that could be CNAs, that could be potentially maybe family members, it could be assisted living communities or rehab centers, right? It's anybody who's caring for those with dementia. And it's training them and giving them the skills and knowledge on how to do this effectively, right?
Yes, yes. It's all of the above, including hospitals, everybody.
Right. That's
What it
amazing.
ends up to do is it's affecting the entire system because
Yep.
they feel confident. They have the tools. We often say, if you send a caregiver without a toolbox that's full only a hammer in it, well, everything looks like a nail. You're gonna nail everything. You want to
Mhm.
make sure they have enough training in there to do their job. This transactional dementia intelligence training that I do a certification, there's two types. There's the fundamentals and there's also advanced for trainers. So in an organization, you'll want a trainer to train the rest of the people. Maybe there's 500 people. So you don't go and train 500 through the ICA, but you train one person as a trainer. And it changes everything because it's the very first step that we need to be able to open communication. And when there's no communication or broken communication, as I call it, then there's nothing.
Yeah.
There's nothing. So you lose all that. So you want to reduce the stress of dementia caregiving, which this training will do. It also
Mhm.
allows the persons living with dementia to be heard
Mhm.
and for everyone to feel understood and appreciated. And it
Yeah.
creates a better quality of life for everyone.
Yeah.
And it lets everyone benefit from sound dementia care. They feel proud after that. They feel understood. They feel they've accomplished something, and it doesn't take much time either. So you save time. It's beautiful. It works very well once they catch on to it.
Yeah. And I can see how this is working because there's nothing like going into a career or field and you're not equipped. You've got a lot on your plate, probably overwhelming expectations, right? And you don't even know how to really do your job in a way that's sustainable for yourself or in a way that you feel like you're making an impact. So having this knowledge is equipping those. But also, again, I'm going to go back to the persons that we're supporting. That's those with dementia, right? Typically seniors, but not always the case. Um, it's making an impact in their care level, in their life, their quality of life. And you shared a story with me last time we had a conversation. I'd love to for our audience to be able to hear that story. But oftentimes we've got caretakers, CNA, family members who do not really understand or have any kind of real training on how to care for these individuals. And they're going in and they're misunderstanding what's happening. They don't know how to respond. They see that there's a lot of threats. And so they typically just back away or they're even hurt. As a caretaker, you're often hurt. And that's only because your lack of education in this area. But on the receiving end, these individuals are scared, they're confused, they're not being nourished all the time, mentally, physically, cognitively. And so there's a greater decline because they're just misunderstood. And I know you know this so well. And it's actually very frustrating as a professional to see this so often. I'd love to hear again that story that you shared with me. I don't know if you remember which one it was, where you went in and you helped to explain kind of what the need was of this individual who was not really wanting to do anything. Do you remember which one I was talking about?
Are you talking about the man who wanted to speak to his brother who
I
had died?
No, this is another story. Okay, you got to share this one.
Well, yes, and this man was following me down the hall in the skilled nursing because he had seen me so many times. He recognized me, and he said to me, "I want to speak to my brother." I said, "Let's go back to the nurse's station and we'll get the information, and you can talk to your brother." So we went back, and I asked the nurse if he had a brother and could he call him. And the nurse had tears in her eyes, and she said, "His brother is dead." She kind of whispered that to me. And I said, "Well, what was his name?" So let's say it was John. And the man was pounding on the desk at that point, saying, "I want to speak to my brother. I want to speak to my brother."
Mm,
Once I got the name, I said, "John really loves you and you love your brother, don't you?" And I was pounding with him, but the pounding stopped.
mhm.
As soon as I said, because this is the key to my training. If you cannot go and validate that feeling, don't
Yeah,
listen to the story. The story is not important. It's the feeling that matters. Now they use that
yeah.
in reducing anger for anybody else in society. They don't have to have dementia. But if somebody is very angry or negotiating, you have to go to a feeling. You don't go to the story. So this is taught in my training as well.
I love that. And I believe the story that I was referring to was similar to this. And of course, we're going to see some similar actions taken by those that are being impacted by dementia, right? But and that was the case, was you are not going into the story. You're not, talking to them more about the story and trying to pull more out of that. You're validating their feeling. And I think that is something that many caregivers don't understand. It's the validation part, right? They get
Well,
caught
they
up.
talk about validation all the time. That's a big topic in dementia care. However, validation for people it has different meanings, but it needs to be only one meaning is that feeling, because when we're born with sad, glad, mad, and scared. We're born with that, and we die with it. But
Mm,
when you have dementia, that's all you're left with.
mm,
So you tap into that. And that's very important, because if once you tap into that, then you can now redirect. You can go somewhere else. You can feed them. You can dress them. You can go and clean them, because now they're with you. They trust you, and they will follow whatever direction the caregiver is giving. There will be no resistance.
yeah. And I want to tap into that a little bit further. You're talking about the brain. And I recall hearing before a previous conversation years, and you were telling the audience about the sides of the brain that is no longer really being used by those with dementia. Can you tell us a little bit about that?
That's true. There's a left brain and the right brain for all of us, of course.
Mhm.
And with dementia, the left brain stops working properly and is very unreliable.
Mhm.
And so they may still access it, but it's unreliable. So the caregiver must know that and must be ready to form a healthy symbiosis, take over those responsibilities. For example, one of the nice things I noticed with my husband at the very beginning, judgment is one of the things that they leave very early. That's gone. Isn't that beautiful? Because judgment is really usually very
Yeah.
subjective, gets us
Yeah.
in trouble.
Yep.
They don't have that. There's no there's no problem with that. So knowing that, but sometimes there's a judgment that needs to be made. Like for example, you need to go and have your teeth checked or cleaned.
Mhm.
And if you can get the attention of the person in the present and then they will follow you without any resistance, you do your work a lot faster. The person being doing the person living with dementia is also very satisfied because they feel that they're understood, they're heard, and they're taken care of. Somebody's taking care of them. So that's really important. And that's the left brain is pretty well decommissioned early, and the right brain functions. That's where your feelings are.
Mm.
And that's where caregivers need to be able to shift to the right brain, which is not easy to do if you don't know about it. But we teach how to do that. We will
Excellent.
teach them how to do that.
I love that. And can you tell us a little bit, because we've got your TDI, right? And then you've got your certification process and your training. And I know this takes time to understand, and to grasp and really master this process and concepts. But there's also other programs out there. I mean, we've got assisted living, memory care facilities, and they have their own types of programs. So I'd love for you to share a little bit. How is your model different from what is already out there in the industry?
We respect all programs that are there, and we encourage people to continue using their program because they're familiar with it. And there's many programs. What the TDI does is that it gives them the golden key to open communication. Then their program follows. There's
Mhm.
no problem. The program can follow. If there's a problem with the program, we look at that as well, and we can help them with that. That's our responsibility. So the golden key, though, not too many people can open the door to communication. We see that. One time I went to a nursing home, a skilled nursing, and the woman was throwing herself down on the floor. And they said, "Oh, look, she throws herself down on the floor, and we don't know how to stop it." Now that was her way of getting her needs met, but they couldn't meet her needs because she didn't understand them, and they couldn't communicate with her.
Mhm.
So it's so important to have that key to open that door and have her assist her in not having to go that far. But you know what she was doing?
Mm.
She was trying to hurt herself to get out of there and get in the hospital and go home.
Oh, that was very intentional. Yeah.
Absolutely intentional. Most of it is intentional because how else can they communicate once they've tried everything, or to them it's everything, and nobody's listening, nobody's hearing them. But she was
Right.
scared. The feeling was scared. She was scared to be there. She was scared of dying.
Mm.
And if somebody had tapped into that, everything would have slowed down and relaxed for her.
Right. So your model really, it helps to assess existing models if there is one, and finds any gaps, provides your training, and then bridges that with the current training, but maybe
Yes.
modifies it to better enhance outcomes for the residents or patients, right?
Well, yes, because you need to communicate. We're
Yeah.
communicating, you and I, right now.
Yeah.
But if you were talking about car races and I'm talking about dementia care, there's no connection.
No.
That's a break in the communication. And it happens every day in dementia care because a program that they already have has nothing to do with opening the communication, starting the day, or anything that happens. One time a person went to visit the skilled nursing, and this man was quite stately, well dressed, very tall, very large, and he was very upset. But nobody was listening to him. He just went up a notch higher, and it gets to the point where people become aggressive. There's no need
Mm.
for that because they need to be understood first, validated, and you never get to the aggressive state.
Yeah.
Never.
Right. So, yes, communication is key, literally
Yes.
key, right? I like that.
Yes.
So, what is the difference in between your certified dementia training versus non-certified? Do you feel this is essential for all caregivers?
Well, certified simply means that if you were a nurse or if you were a physical therapist and you need credits,
Mhm.
that's all that means. That is certified so that you can get credits. But most people, CNAs, do not need credits, and they would have to take the training anyway. But you have the best thing is you have to pass a certain level of training. It's all looked into by an organization, and they say this is fine. You have a good exam, you have a good training, a good exam, and we
Mhm.
certify your training, and then we get the certification. But the whole thing about the program here is because for over 30 years, when I was a mental health counselor, I used transactional analysis, which is the basis of my Lord's theory, which I call the psychology of dementia brain. But I studied with Bill Krager in New Mexico. I studied also with Abe Wagner in Colorado, studied with Emily Rupert in Boston. And I used that in everything that I did. I was a management coach and in my training, as well as with the mental health with all my clients, I use that. Now I'm using it in dementia because this is over 60 years old, this theory by Eric Byrne. He was a psychiatrist and it works perfectly for dementia care. I don't know
Mhm.
if I'm the first one to discover that and create this theory that is so powerful because it reduces stress immediately for everyone, and the communication is clearer and effective, and it quickly sets the stage for redirection. Because
Right.
in dementia care, it's all about redirection. The person comes confused, spaced out. They want to know what's going on. Sometimes they're very upset, and you clarify all this. And now you can say, let's go do something else. And they'll follow you. They'll follow you very happily.
You mentioned that, you know, we could do this training and certification training education with senior living communities. We can do it with home care agencies. I think that's a huge one, right? Home health care, hospice. So there's a lot of different organizations that really should have this type of training. But I'm going to go to just family caregivers. If you are taking care of a loved one, just like you had to do with your husband so many years ago, if you are doing that in your home, what would you say to somebody that's coming to you and they have a spouse with dementia and they're trying to take care of that spouse the best way they can, but they do need some kind of formal training? How does your training really support them specifically as a family member?
Yes. We call that the dementia world. And I'll give you an example so it really hits home. This woman contacted me, and her husband had both MS and dementia, and he was an engineer by trade. And so we looked into that. It was only a 20-minute talk, but in 20 minutes, I changed her world. And how I did that is because she she said they were fighting a lot come the end of the day, which is common, but doesn't need to be. And I said to her, you need to give your husband uh, some purpose in life. And how do you do that? So I showed her how to give him some purpose in life, even with his dementia, especially because he was an engineer and he was more or less set on the back. And she was doing a lot of things for him, but he was set back there without any responsibilities. And that made him feel pretty useless because with dementia, they're not stupid or anything else. They just think differently. So he's processing information differently. And I showed her how he did that. And in that process and of showing her, she went and took the training, the fundamentals, and she's a family caregiver. But then in 2 days, only 2 days, she called me and she said, we were doing cooking supper together tonight. He was whistling and I was singing. And that never happened in the time that he had been diagnosed. And she was so happy about that. So it changed their life, changed
Yeah.
his life, changed her life.
Yeah, that's so good. That has to feel so rewarding. There's programs out here. I'm in the Bay Area, California, and Dr. Lord, I know you're in multiple locations, but remind us or tell your audience where you're located.
Well, we have two offices, one in Maine and one in California, the two sides of the country, both ends in the middle. And then we also have business all over the world. Actually, it's international.
Yeah,
So we have people. We're training people everywhere in every country.
which is fantastic. And I know I asked that because there are nonprofit organizations in California, I'm sure everywhere, similar to how you're kind of set up, that help support those with dementia. I still feel like there's this massive need for the training. So going through the ICA, getting the training, the TDI methodology, understanding all this is super important. But to complement that, there is groups out there that support partners, right? With understanding how to communicate with each other. And kind of your story made me think of this. Here in the Bay Area, we have a nonprofit group called Connected Horse, and it's horse therapy. And I love it. It's just a beautiful program. So we'll bring the person with dementia and their caretaker. It could be a family member, it could be actual like a CNA or caregiver, home care provider, and we take them to the barn where Connected Horse is, and they kind of go through taking care of the horse through horse therapy and working together, and it equips them with kind of that what you just said. There was the person with dementia didn't have a task, right? They were just kind of left behind. So it gives the person with dementia a task, something to do, a purpose, and it helps the caregiver to learn how to communicate with them in more meaningful ways, and it opens that up. So like you're saying, communication truly is key. And I've heard you say that so many times. We have the key. And you do when you can learn how to communicate effectively and understand the person that you're helping and supporting with dementia, that just makes the difference of the world, And so your program truly is really opening doors for people, whether it's the caregiver or the patient, a person with dementia, right? So or Alzheimer's, whatever that might be, right? So I wanted to go into, before we conclude our discussion, I really wanted to go into the misconceptions about people with dementia and how they feel and how they think. I know you tapped into this a little bit, but I think this is so important because if you aren't educated at all, and say maybe you are a family member listening, you could be a professional and it's just getting into the industry and you really just don't understand it yet. There's a big risk, right, with misunderstanding someone that has dementia and what's really going on. So, can you tell us a little bit about those misconceptions?
Yes, I can. But before I do that, I want to go back to your story with the horses.
Mm-hmm.
It's an important story. But even in that story, let's say you're the one with dementia and you're going to that barn. And if I say to you, Athena, listen to me, I need your help. I have you now. And I can say, let's go brush the horses together. That's purpose for you. It's clear communication. And I can now redirect you.
Yeah.
That's how easy it is to do. That was just an example. So yes, to go back to your question about the myth, there's three big myths that I can name. The first one is that dementia is a disease. Well, dementia is not truly a disease. It's a condition, like a lot of other things, that we need to learn how to communicate and serve better. That's number one. The second myth that I came up with is all types of dementia are the same. There are many types of dementia. And though some are more common than others, like the vascular dementia my husband had, however, the TDI training benefits all different types of dementia, no matter the age, the condition, or the classification, and no matter where in the world. Doesn't matter if you're a Japanese or if you're an American. And this training is universal and is changing the course of dementia care, which was my whole mission. And the third one is losing your memory and getting confused is a natural part of aging. Dementia is common in the aging population. Matter of fact, 50%. of people 85 and over, 50%, will be diagnosed with some form of dementia. Okay. And there are over 7 million known cases in the United States, 7 million, with over 60 million in the world. So we need to learn to provide the best possible dementia care. Let it begin with communicating clearly, effectively, and rapidly to avoid common problems of resistance on the part of the care receiver and burnout for caregivers.
That's so good and true. And I love that you gave us some numbers. That's important to really grasp, right?
Mm-hmm.
This is something that is kind of prevalent. It's not just something we can brush away, and it will continue to grow. So having a deep understanding of it, really getting rid of those misconceptions and those myths about what this is. This is important because there's 1 in 10 people in the United States, right, ages 65 and up, have dementia. That's huge. And then
Yes.
this is going to increase, right? So I think that there's studies saying that dementia cases per year is expected to double by 2060. And that's far off, but it's really not when we're thinking in terms of care and the time frame that we have to really support that amount of people with dementia. And we talked about this. There's a big gap in the care that's offered today. There's a need. There's burnout. So we really need to learn how to avoid this and how to get on top of this ahead of time. So such a huge area of concern. So places like ICA, they're needed. And people need to know about this. The training, people need to know about this, whether you're a caretaker or you're just a family member who has someone with dementia. If you're getting into the field of working with seniors, you should know about this. You should learn how to support people with dementia, right? And I'm wondering, because this is a growing concern, Dr. Lord, what do you think the future of dementia looks like? And what do you think our world looks like? If you can look in the future, just go 15, 20 years, what's this going to look like?
Well, I think all people need to feel empowered, understood, and respected, less stressed out, and reduce the burnout and improve the quality of life. So it really is imperative that we reduce stress for everyone. Everyone feels heard, understood, and appreciated, and to create a better quality of life for everyone. Everyone benefits. So I want to ask you, do you have that key that you need to open that door? We can cut you one.
That's amazing. Well, Dr. Lord, thank you so much for being here today. This was such an insightful conversation. I feel like there's going to be more to come from this. I can foresee in the future us talking again. We just need to get the word out. And like you said, do you have the key? Such a good question.
Thank you.